Module Overview. This module is one of the cornerstones of healthcare migration readiness, especially for internationally trained professionals aiming to work in the United Kingdom, UK, and the European Union, EU. Language proficiency and regulatory licensing form the gateway to registration, employment, and even visa sponsorship in international healthcare systems. Without passing mandatory English proficiency tests, such as IELTS Academic or OET, Occupational English Test, and professional licensing assessments, such as CBT, Computer-Based Test, and OSCE for UK nurses, applicants cannot proceed with their career goals abroad. The module explores test structures, past benchmarks, preparation strategies, and approved test providers. It also walks you through key regulatory bodies like the NMC, Nursing and Midwifery Council, HCPC, Health and Care Professions Council, and their equivalents across Europe. Emphasis is placed on documentation accuracy, legal credibility, and ethical compliance, ensuring migrants remain competitive and qualified under global standards. The module will also introduce alternative certification pathways, routes for requalification, and how to avoid agencies or individuals that offer fake or shortcut credentials. English language proficiency tests. IELTS versus OET. IELTS, International English Language Testing System. Academic required by UK NMC and many EU hospitals, score requirement for UK healthcare. Overall band, 7.0. No individual band, less than 6.54 test components. Listening, reading, writing. Speaking preparation, self-paced online prep. Cambridge IELTS books, British Council and IDP test centers. Validity, 2 years OET, Occupational English Test. Profession-specific English for healthcare. 4 components tailored to job scenarios: listening, e.g. patient interviews, reading, e.g. medical memos, writing, e.g. referral letters, speaking, e.g. patient consultations. NMC/OET score requirement: grade B in reading, listening, speaking, C+ in writing. Accepted in some cases, excepted for nurses, doctors, physiotherapists, pharmacists. Advantage: familiar medical context. UK regulatory requirements. Nursing and Midwifery Council, NMC UK, oversees licensing of nurses and midwives. Application stages: eligibility and qualification check, language test, IELTS, OET, CBT, computer-based test, theory exam, OSCE, objective structured clinical examination, practical assessment, UK-based, NMC registration portal, common errors in NMC documents, processing fees, timelines and renewals, Health and Care Professions Council, HCPC UK, for non-nursing professionals, physiotherapists, radiographers, biomedical scientists, occupational therapists, requirements, English test, IELTS/OET, degree recognition, evidence of clinical practice, CPD log, continuing professional development. CBT and OSCE UK focus, computer-based test, online multiple choice test. Topics include professional values, nursing practice and decision-making communication, leadership and teamwork practice questions, available on NMC platform required before visa application, OSCE. Clinical practical exam, conducted in the UK. Hands-on assessment stations include patient assessment communication, infection control, drug administration, preparation via NMC-approved training centers. European certification requirements. EU language requirements: German, for Germany, B2 or C1, Goethe or Telke exam, French, France, Belgium, B2 DELF/Delft Dutch, Netherlands, NT2 Dutch as second language, No English-only option in most non-UK countries. Country-specific test centers. Professional revalidation. Recognition of third country qualifications. Apostille/legalization of certificates. Licensing via local healthcare ministries. Additional training/bridging programs for adaptation. Recognized documentation and application tips. All documents must be legally translated apostilled if required, scanned in clear PDF format, sent to verified regulatory bodies, only fraudulent documents, permanent blacklist. Certificates must match passport name and DOB, never pay someone to write tests for you. Learning outcomes. At the end of this module, you will be able to clearly distinguish between IELTS and OET and choose the right one for their healthcare role. Understand regulatory requirements for UK/NMC and HCPC licensing. Navigate CBT and OSCE preparation and scheduling. Comply with EU country-specific certification and language needs. Avoid immigration and documentation fraud through informed decisions.